Welcome to Cardiac Anatomy for Radiology. This is part 3 of a 10-part series looking at the basics of cardiac imaging anatomy. It's going to be useful for anyone who's studying for their FRCR examinations, and it's also useful for anyone who's wanting to revise the cardiac imaging anatomy. So this is part 3, and we're now going to go on to look at the great vessels. So as the title suggests, these are the big vessels in the chest. So we're going to start with the veins that lead blood towards the heart. The right atrium has 2 points of inflow that are the inferior and superior vena cava. As the name implies, one's at the top, one's at the bottom. And you can see on the axial image here, we've got the left ventricle, the right ventricle, the right atrium here, and this tube-like structure here is the inferior vena cava. And then on this image here, we've got the aorta and the left ventricle, the right atrium here, and coming down from the top, the superior vena cava. So you can angle up your image on the CT scanner to the plane where you can see both of these. So here again, we've got the aorta, aortic valve, left ventricle, and on this side we've got the right atrium. This is the superior vena cava, and this down here is the inferior vena cava. The next big vessel that we want to worry about is the pulmonary artery. So blood comes in through the superior and inferior vena cava into the right atrium. It passes through the tricuspid valve into the right ventricle, and then from the right ventricle it's going to go to the lungs. So it goes via the pulmonary artery, past the pulmonary valve into the pulmonary artery. So here we've got a nice 3D reconstruction. The bright red bit here, this is the aorta, and you can see here the bright red tubes of the coronary arteries, which we'll come on to at a later date. And going over the front of this, we've got this pulmonary artery. So here again, we've got the aorta, the ascending aorta here, and this is the pulmonary valve. You can almost see it just in there, and this is the main pulmonary artery. It branches to give the right and left pulmonary arteries here. So we've got main pulmonary artery, pulmonary trunk, and the right and left main pulmonary artery branches. So the next big blood vessel in the chest is the aorta. So this is the really important one that takes the blood from the heart to the rest of the body. So I've got a stylized diagram here of the aorta. So this box, this is the heart. And blood comes out of the heart in the ascending thoracic aorta. There's then this arch, which is aptly named the arch of the thoracic aorta. Then we're into the descending thoracic aorta, and when we pass through this blue bit, this is the diaphragm, we are into the abdominal aorta. It's very important for anyone sitting the FRCR examinations to remember you can't just say aorta. You do need to remember these different bits: ascending thoracic aorta, arch of the thoracic aorta, descending thoracic aorta, and abdominal aorta. And in pretty much all cases, it's pretty easy to tell which you're dealing with. So this is a nice 3D picture of that same stylized view of the heart and the aorta. So this here, this is the heart. Believe me, it is definitely the heart. Then we've got the aorta here, this nice tubular structure. So this first part is the ascending aorta. We've then got the arch of the aorta, and then we've got the descending thoracic aorta. So on axial images, we've got these 2 circles here. So how do I know which is the ascending and which is the descending thoracic aorta? I know it's the thoracic aorta because I'm in the chest above the diaphragm. Well, the first clue is that this one here is really near the heart. This is the heart here, and it's in front of this pulmonary vessel here. So this is the ascending aorta. The aorta then arches over, and we've got the descending thoracic aorta at the back here. So ascending thoracic aorta, descending thoracic aorta. And then there's some branches of the thoracic aorta, and these are really important branches. And it's really important to remember these names. We've got the brachiocephalic artery, which is the first branch coming off the arch of the aorta. This divides into the right subclavian artery and the right common carotid artery. The next branch of the arch of the aorta is the left common carotid artery, and then we've got the left subclavian artery. If you look at this CT scan here, you can see the arch of the aorta here, and we've got the branches coming off in order here. So we've got the brachiocephalic artery, brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. So that's it for the great vessels. Thank you for listening to Cardiac Anatomy for Radiology, and we'll be back next time with the coronary arteries.